Hi, I'm Todd Saunders, the massage therapist here at Lickstein Plastic Surgery. I do a wide range of massage services ranging from relaxation to deep therapeutic work, along with deep tissue, fascial work, neuromuscular work, as well as I would do post-surgery work that is geared primarily around the lymphatic drainage and the lymphatic system itself for speeding up and starting that healing process. Okay, as far as lymphatic drainage goes, initially after surgery, whether somebody is having liposuction, tummy tuck, or a breast surgery, whether it's breast augmentation or breast reduction, or even someone going through the reconstruction process following cancer, that it all begins with lymphatic drainage. Now, the lymphatic system itself is a pretty unique system that is primarily used for moving waste products and toxins out of the body and tissue. Its primary responsibility after surgery is to help reduce and eliminate the swelling and bruising that is associated with surgery. So as I was saying, the lymphatic system is responsible for getting rid of the bruising and swelling. One of the common questions that is asked to me is, will this hurt? Lymphatic system workage and lymphatic drainage is very, very easy. The wonderful thing about it is the lymphatic system is right underneath the top layer of skin. So our work is very superficial because the system itself is very superficial. So it makes it very easy to start working on patients. As soon as within a week after surgery, we can start. Granted, every surgery patient's a little bit different, so we'll always need to consult the doctors before we start with our process. So again, like I was saying, we can start pretty quickly after surgery to start with this healing process. Now, as we were saying, the lymphatic system is one of the systems to help get rid of the bruising and swelling. The other thing that is so important and why lymphatic drainage helps with the healing process is the lymphatic system isn't an active system in the same manner as like the circulatory system, where the heart is constantly pumping blood throughout the system. The lymphatic system doesn't have that active pump. So what actually moves the lymph and the fluid through the lymphatic system is primarily by the way you're moving and walking and exercising. But what happens after surgery is you need that downtime, plus you've had trauma to the area, which slows down the system from working, as well as you need to rest and recover at home so you're not as active. So that's why the lymphatic drainage can play such an important role, is to help manually move that fluid to help alleviate the bruising and swelling. So now that you have an understanding a little bit of how the lymphatic system works, along with the importance of it after surgery, let's look at the system of actually how the system works and how we're moving the fluid to certain areas. The first part is the lymphatic system is broken up into somewhat of quadrants with the body. The face and neck has its own quadrant, which we're not going to talk about that today. We're going to focus primarily on the body. The first part is I'm going to use this string to lay down right down through her midsection. So we have a right side and left side. Everything on the right side stays over on the right side. Everything on the left side stays over on the left side. Next, there is an imaginary line, or it's also called a barrier, right through the mid-abdomen, basically a little bit above the belly button, represented by this line. So as you can see, we have 4 quadrants of the system that we're going to be working on and dealing with. And in each quadrant, there is an area called as far as a collection site, and it's also referred to as a drain site. That's where everything is working towards, as we want to move everything to those drain sites. Now, in the lower right and lower left quadrant, the drain site or the collection site is located in front of the inguinal area, or commonly known as, it's right at that crease in the front of your hip. In the upper right and upper left quadrant, the directional flow in the collection site is actually in the axilla, or other known as in the armpits. So that's the direction that we're always moving the fluid. After it reaches these collection sites, it actually goes into a deeper system that is located deep in the thoracic duct. But for our work and what we're doing is we're always working towards these collection sites. Now at these collection sites, it is very, not important, but to understand that everyone has heard about these lymph nodes. Well, at each of our collection sites, there is actually a chain of lymph nodes that basically become your filtration system. They're filters that germs and bacteria can be destroyed a lot of times through these lymph nodes. So lymphatic work in the lymph system itself is actually a very big part of your immune system. So any massage work and incorporating some lymphatic work is also a great way to boost your immune system. But following surgery, what we're going to do is we're going to represent as if someone has had liposuction down here in their inner or outer thighs or quad area and lateral hips. Basically, how lymphatic massage is performed is we basically start up at the drain sites, where we're going to start working and stimulating at the drain sites or the collection sites. Once we have worked on that area, basically then from there, we're going to always start at the drain site and work away, but all of our directional motion and flow is moving everything back towards the collection sites, and we're going to work our way all the way down, and then we're going to trace ourselves all the way back up to the collection site. And I will repeat that as many times as I feel like I need to, depending on the amount of bruising and swelling that is associated with that procedure. Once I have fulfilled and done my work on the one side, I would proceed to move over to the other side. Now up through the abdomen area, if somebody's had liposuction or a tummy tuck, the same principle works. Again, we're going to start at our collection site, stimulate through the collection site and or clean it out so there's room for more fluid to flow into. And we're going to work our way again from the site. We're going to come out and work through that quadrant of always bringing all the fluid and motion back around to that area of the collection site. Again, repeat as much as needed before we move over to the other side. Now we're making our way up into the upper quadrant. The same again as the principle of starting at a collection site, moving down, but all the motion is always forward. Abdominal, starting at the collection site, moving away and around, but all the motion and movement of fluid is towards the collection site. For the upper quadrant, it's the same principle. We will start at the collection site and we'll move down into the upper abdomen, bringing the fluid towards the collection site of the armpit, and from around the breast, bringing it around into the collection site itself. And again, we repeat as much as needed before we move on to the other side. As I was saying about how superficial the work is, since the system is so superficial, it makes it easy to work on everybody no matter what level their discomfort level is. At the same time, the lymphatic work also stimulates the parasympathetic nervous system, so it can actually help decrease your level of discomfort. As the patient progresses week to week, our work progresses, but it always starts and focuses around lymphatic drainage. As the patient is progressing, we will slowly start working deeper into tissue and fascia to basically keep that tissue nice and soft and supple. At the same time, as we're moving along in the weeks, we can also do deeper work around incisions and so forth to help minimize some of the scar tissue. But The healing process begins as early as possible as we can following surgery. It all begins with lymphatic drainage, but remember to always consult your doctor before you start any lymphatic drainage work. Thank you.